Welcome back to more on this Wednesday. The Fertility Center of Las Vegas has been leading the way in fertility options and treatments and has been recognized for work and research in the field nationwide as well as across the world. I mean, around the world. Across the world, no, globally. Here today to tell us more about fertility options and treatments is Dr. Bruce Shapiro. Welcome back, doctor.
Oh, thank you so much for having me.
I mean, you really are globally known. People have come to get your services because you guys really are leading the way in what you're able to do to help people have families.
That's correct. We see people from all over the world. But what's really nice is we have services that people from all around the world seek out for us, particularly here in Las Vegas, and yet we can supply the same services to people here in Las Vegas, our own patients.
We don't. People who live here don't have to go anywhere. There's no ticket involved. And one thing that's really, you know, a hot button right now, and people are getting more and more options for, is genetic testing. And there's some testing you can do to increase your chances, if you're going to go through all this, to have a healthy pregnancy.
That's correct. What we can do now in vitro fertilization, before we put embryos back into the uterus after the egg has been fertilized and the embryos have developed in the laboratory, we can actually take a little biopsy of the embryo and determine whether there's a normal number of chromosomes. And the ones that don't have a normal number of chromosomes can't develop into a normal healthy baby. The ones that do have a normal number of chromosomes can develop into a normal baby. So we can now eliminate many of those embryos that were never destined to go anywhere or do anything once we put them back in the uterus, and now we can put in just the healthy ones.
Wow, modern medicine. And this is really a wonderful, you know, advancement, because I'm sure when people come to see you, maybe they've had a lot of miscarriages or struggles having a baby, so to avoid them any further heartache is wonderful.
That's correct. It's been really a boon to many, many patients. They're very, very happy with it. And we can also do some other things as well. We can actually tell if the embryo carries two recessive genes that could cause a problem. For instance, in the United States, there are a large number of people that carry one gene for cystic fibrosis that doesn't affect them at all. But if their wife or husband also has a gene for cystic fibrosis, there's a 1 in 4 chance that their baby or embryo could have cystic fibrosis.
Wow.
We can now identify that in the embryo before we put it back in, so we can eliminate the full-blown disease in their children.
And what you're looking for too, I'm sure when people seek, you know, fertility treatments, a lot of women are advanced age, so, you know, their chances of carrying a baby to term or having a healthy child is diminished, you know, from being younger. So you want to give them the best possible chance with the healthiest embryo possible to carry to term and have a healthy child.
That's absolutely correct. You know, we're going more and more now to single embryo transfer. We have found that if you put one embryo back in the uterus and you have a singleton gestation or a singleton pregnancy, one baby at a time, it's much healthier for both the mother and the baby. So what we want to do is we want to make sure that the one embryo that we're putting back in is the healthiest one that we can find. And one component of that is the chromosomes. If we have a normal number of chromosomes and a genetically normal child that's guaranteed from the biopsy of the embryo, then everyone's happy.
That's amazing. And also on another level too, you're able to test for gender, to know this is a boy embryo or a girl, right?
That's true. That's
Is that
true.
becoming more popular with people who come in and they've had maybe, you know, 5 girls or 5 boys, they're hoping to have the other, you know, sex?
That's exactly right. You know, in the old days, people would want to do family balancing. So if they had 3 or 4 girls in a row or 3 or 4 boys in a row, they kept going so that they could have family balance and get the opposite gender.
Yeah.
Well, now people like smaller families. So many people who want smaller families don't have to get these large families just trying to get the gender they want. So if they have 1 or 2 of the gender of one gender and they want to balance the family, they can now have the opposite gender right away. So we can biopsy the embryo and find out if it has a normal number of chromosomes and then determine whether it's male or female.
Wow.
And then we can put back in what the patient desires.
It's amazing the advances you guys have made just in the last, you know, even 5-10 years.
That's correct. That's
wow.
correct.
And I just think it's great. You know, options are always good. They're there if you want them. It's just wonderful that you guys have so many ways to help people become a family and have children.
Yes, we think it's just marvelous. Making families is just one of the most beautiful things there is in the world.
I'm sure. Well, you just light up when you talk about it, and you do such a great job. So thank you so much, Dr. Shapiro. Really appreciate it. All the information, of course, about Dr. Shapiro on the Fertility Center is on our website. If you have any questions, go ahead and give them a call or check out their website. Jason, over to you.
All right, thanks.